I was diagnosed with seborrheic dermatitis. Unbelievable. If this is something that you are interested in, make sure to like, subscribe to my channel, and definitely if you have any comments, just leave them down below. In today's video, I want to share with you my experience that I had. It's not a really nice experience, but yeah, we're gonna go together into it and figure it out. Hi everyone, and welcome back to my channel. So, I just went to a dermatology to find out what it is. I was thinking to film my experience. I was thinking to do this video because I am thinking that out there is a lot of women, a lot of men, a lot of children as well, that they are trying to figure it out what seborrheic dermatitis is. Well, I didn't know until I saw it, to be honest. I have this problem, let's call it like that, for about 5 years, I should say, but it never was like that. When I find out, it was 5 years back. And I just ignored it. I thought that it's something like, because of the weather, my skin is getting dry, which is something normal. Well, yeah, when it's cold outside, the skin becomes dry. Your skin is dry, or there is something else. Well, yeah, that's what I thought. 1 week, 2 weeks, 3 weeks, 1 month, 2 months, my skin, it was dry. And it was that kind of dryness that it started also with kind of peeling skin, if you know what I mean. Something like that. Yes, we'll go right there in a bit. After a couple of months, it became red. Oh yes, red. And I started to wonder, well, again, I thought that it might be, an allergy or something like that. I thought I might have eaten something that is not good for my body. And then I say that I might have been using a cream for my face that, my skin doesn't accept it. I might have an infection or something like that in my blood. That's what I was thinking, but never went somewhere to check it out. I tried a lot of products, good products, expensive products, nothing used to work for myself, nothing at all. I just left it like that. One day it was good, 3 days it was worse. Then again, like a week it was good, a day it was worse. My advice is, if you spot something like that, don't wait like me many years. Just go and check it out. It's worth it. And don't wait such a long time like I did. It's no point to wait because it's not going to go itself. Well, I went on the end to a GP to look at it. I start having like dry skin everywhere on my face. After that dry skin, I used to have like red things around in certain places. I start by having here. That was the first time. The second, I start having somewhere in here. Then it went on top, right in here. Yes. Then when I saw that it's going somewhere in my head, I say, no, this is not an allergy or something like that. This is something bad. I should go and see the GP. The first doctor that I seen, I do remember that he was looking at me, checking myself, asking the basic questions about family members, if they had, and all of this stuff. But yeah, nobody from my family has something like that or never had something like that. It's only myself. Yeah. Well, the doctor said, there's nothing to worry about. Use this shampoo. I used the shampoo, never worked. Yes. They gave me a cream, which I have it those days as well, which is this one. This is the best cream that I ever had from any of the GPs here in the UK. I can't complain about that. So I'm still using it even now. Well, yeah, even now. If you wonder why I still have those marks on my face, it's because I stopped it. And I tell you in a bit why I stopped it. Nothing worked with the first doctor. Then I went to the second doctor. The second doctor gave me something to use it for my scalp, for my head, which is this one. It's called Beta Cap. It's a very good solution, liquid. It's kind of antibiotic. It's amazing. I can't live without this one. I'm using this one for about 5 years now. and the cream as well, which they work amazing. They are amazing. But what happened? I went back to the GP because I started having a really bad skin, red everywhere, itching a lot. And I said, this is not possible. I can't live like that. This has to go away. It should be something to go away. I say, I can't live like that. I can't go out like that. Everyone is looking at me like I'm not a clean person. I don't wash my face. I don't wash my hair, which is unbelievable. It's not about cleaning yourself. It's something that it comes from your body. Yes. And when I saw the doctor, I say that, well, it's no point for me to use those medications every single day, every single month, every single year if they don't work. And what I mean by that is they work at the time that you use them. But if you stop them, they don't work anymore. It's just coming back. I used to put a prescription in every single month. I was just getting fed up of using those products every single day without seeing an improvement. And one day, pissed off, I just called GP and I booked an appointment. Yes. And I say, doctor, I'm fed up of using those ones. If I stop them, they don't work. Look at my face. Look at my head. This is unbelievable. Well, and the doctor asked me, did you ever went to check yourself to dermatology? Nobody recommended me by now. I was keep asking every single doctor to send me, and nobody sent me, just because they thought there is no point for you to go because this is nothing to worry about. So the doctor referred me to the hospital. I thought that I will go to a hospital, but yeah, it wasn't a hospital, it was a clinic. I've been waiting for the appointment to come over 6 months. Well, yeah, I just received a letter that I have an appointment, which I have to attend it, which it was yesterday. Yeah, Saturday, 4th. I wake up in the morning on that day when I had the appointment, so excited, so happy, so self-confident, if you know what that means. Yes. Why? Just because I know that I'm going to dermatology. I'm going to see a professional doctor, which will help me to get rid of this. So the cream and the antibiotic that I use for the scalp, I just stopped them with a week before to go there. I have pictures, I have videos, so at the time that I'm going to upload this video and you will see it here on YouTube, you will be able to see that videos as well because I'm going to attach them somewhere in this video. So you can have a look to see how bad my skin it is. So yeah, I went to that clinic and yeah, I went earlier than my appointment is. It was at 9:15. The doctor wasn't even there. Yeah, I had a bad situation to say like that. It came 9:30 and in front of me is supposed to be one more person. Well, finally, I went in. I saw the doctor nervous and I asked if she's all right because it was a she. She said, well, yeah, it's just my first time here at this clinic. And I said, okay. I start to encourage her. Ask me a few questions like if anybody from my family had something like that. I answered no. And then it started to ask me what kind of products I use for my skin. My answer, it was only this one and only this one. I took everything that I'm using for my face to show to her, just in case if she was asking, or if not, to show her, to know for myself that I'm using the right products. My face doesn't accept anything. Whatever I use for my face, it's just becoming against me. It's nothing that I want to deal with. If I use any cream, no matter if it's expensive, if it's good, if it's bad, no matter what I use for my skin, it's just reacting bad, red and itchy. If I change the shampoo right now, I can't tell you how my scalp is like. I can't use even makeup. After 1 hour of applying the makeup on, it's just itchy. It's starting to be itchy. If I remove the makeup and I look at myself, it's just red, like a watermelon. I'm not proud of this. I'm just trying to share my information that I got so far because I did a lot of researches about that. I try to improve my health, my diet, food, all of this stuff and the products that I use, but still doesn't go away. To figure it out from where it is and where it will go and if will ever go away. You might have good products. You might know some of the information that I might not know at this point. If you would like to share that with me, just please comment down below and let me know what you are using, how is your situation. Going back to the doctor, to the appointment, she said to me that I will prescribe something very good for yourself. I sent the prescription to your pharmacy. I wish her to have a nice day in that clinic. I just went off, but I forgot to mention something. She prescribed some of the medications, just like so, in a piece of paper. She prescribed me another 4 products to get them over the counter. I went to the pharmacy to pick up those 4 products and the prescription as well. I picked them up. Finally, I did, and here I am. Let's read the letter. It says diagnosis, seborrheic dermatitis. Treatment plan, cold tar shampoo. Wash contact time 5-10 minutes. I remember the doctor saying to me to, whenever I use the shampoo, to leave it on my scalp for about 5-10 minutes before to rinse it off. So I believe this is the one because it says cold tar extract and bee shampoo on it. So this is the product on the box looking like. It says T-gel therapeutic shampoo from Neutrogena, cold tar extract, effective treatment for scalp psoriasis, seborrheic dermatitis, dry itchy scalp, dandruff. So in my case, it's seborrheic dermatitis for dry itchy scalp. Treat itchy flaky scalp. This is a bottle. This is the way it looks like. It's 250 grams, and I remember paying about 15 pounds, 14 pounds and something, 15 pounds, but I will leave all the links down below just in case if you want to use them. Then it says Protopic 0.03% once daily for 6 weeks. Protopic, I believe is this one, and this is a cream. Apply once daily, thinly. Protect your skin from sunlight, even on bright but cloudy day. Do not sunbathe. Spread thinly on the affected skin only. Do not drink alcohol for external use only. I don't drink at all alcohol. I mean, they drink plenty of coffee. Yeah, I'm a coffee lover. Then the next product, it says Enstellar for scalp. Enstellar, I believe it's this one. Here we go. Anything on it? Yes, it says shake can for a few seconds before use. Hold the can at least 3 centimeters from skin and spray. Do not apply directly to the face or eyes. Wash hands after use. Oh yeah, it's a can. And another product I got is lactroconazole. 1 daily for 14 days. I believe those are the medications because when I went to pick up the prescriptions, they didn't have a medication, and I believe it's this one. They told me to come next day, which it should be today or tomorrow. But yes, I don't have unfortunately right now, but I'm gonna try to Google it. I'll leave you right in here, and yeah, I'm gonna link it down below as well, just in case if you want to try them. And it says in here a follow-up should be done as well, which definitely whenever I go there, I'm going to share it with you. I'm going to share every information I got. I'm going to share every single product that I'm going to be using. Any information that I got, I'm going to be here for you and share it with you because I know how bad this disease is like. And yeah, unfortunately, this is what it is. So yeah. Yeah, we have also whatever we talk. So thank you for referring the above patient to the dermatology clinic. It is a pleasure to see her today in community dermatology. She was referred by GP for second opinion. Reports she suffering with seborrheic dermatitis for 5 years. Tried quite few shampoos, prosaic on scalp and beta novate on face with no much luck. Yeah. Scalp very flaky hair, line red and around nose and eyebrows, itchy rashes. Well, yeah, this is the worst thing that you can ever have. Itchy is the worst thing. Says on stopping treatment, skin and scalp back to worse. No other medical history, not on any medication, enjoy good health. On examination, loose flakes, mainly frontal scalp, no rash, knob of neck, behind ears or elbow, no nail changes, face slight erythematous, eyebrows and paranasal area. Plan. We have discussed the diagnosis, chronicity and flare up and offered above treatment. Review in 3 months. Doctor, name, and the clinic is called Modality. if you want to do a research about it. So this was my experience with the appointment that I had, and I've been waiting for it for over 6 months. Those are the medications that I got, the products that I got, and yeah, I'm gonna try them on, see how they work, and I'm gonna be here with you every single week when I'm using them to update you and to show you and to tell you if they work or not. And hopefully by the next appointment we're gonna see some improvements. I wish it will go away just like so, just wake up in the morning and get rid of those things, because it's not a nice thing that we wish for. And yeah, it's a shame when you go somewhere out, if you go to work, if you go whatever, and people looking at you, they will think that what I'm having. And yeah, I know it's a lot of you that is having the same problem, the same situation. And yeah, there is no such a treatment for this disease to treat it. I ask all the doctors that I went to, and they said the same thing, that there is not such treatment to use it and just get rid of. It's something that you're gonna have it for all entire life. So all entire life you have to live with. And also the doctor said that you have to improve your lifestyle, to make sure whatever you eat, to make sure whatever you use for your skin. And definitely, if you're asking me what's the reason for this to cause such as flaky skin and itchy, is stress. So try to remove every single piece of stress that you have in your life. Just kick it out of the window, get rid of it, try to sort out your problems, because this is the major cause in our life. So yeah, so right now, hopefully the video, it won't go too long. I want to use the products and yeah, to share it with you. So if you have any skin problems like dermatitis, if you have any dry skin, if you have psoriasis, yes, try and sort it out. Don't leave it like that. So if you want to find out a treatment for yourself, if you want to find out where from it's coming, or you don't know what steps to go into to sort it out, just make sure to watch this video in full, so you will get some information from my side. If you have any information because you got treated, or you went to a clinic that it was worth to go to, you use certain products, better, good products, or yeah, cheap, expensive products, no matter, just please leave them down below. So me, myself, and others can try them out. So make sure to watch this video until the end. If you enjoyed this video, if you got a good, helpful information, please consider to like, subscribe to my channel, and if you have any comments or any information that me, myself, us, we need, just leave the comment down below. Thanks for watching.